Let's go ahead and get started. Welcome to OE7. For those of you who are new to open enrollment, welcome. For those of you who are returning, welcome back. We know this is busy. We're really happy to have you all on our team, and we're really excited to support the work you all do on the ground here. As I said, we like to start big picture here. What is the connector? What the heck are we talking about here? Basic level. It's a scheduling and reporting tool. It's designed to help keep things simple and make it easier for assisters to work with others in their area, as well as for consumers to find you. So what do we mean by this? We mean a couple things. Number one, it's one place to keep your schedule, one place to track your appointments, one place to direct consumers who need to find help and need to book an appointment, and one place to analyze your data, analyze your reports, to tell the story of your success, your open enrollment period, your work as enrollment assisters, to work collaboratively with everyone in your area by having one central place so that there's less confusion and more time spent working together collaboratively. So, what's new? We've been working on some exciting stuff over the past few months. We're going to look at all of this today in due time, but just as a quick overview for those of you who are looking for the quick hits, 5 big buckets of things that we've done. We've improved our reporting experience. We have allowed you to export your schedules to your personal calendar, allowing for sort of a continuous sync so that you have one place to check all of your availability, or I guess not availability, all of your upcoming appointments, be they personal, be they non-enrollment related, be they enrollment related. One-off appointments and more customization in scheduling and schedules. We're going to look at some improvements to the widget, including what we call RSVP links, or the ability to direct people to a specific widget location, and as well as some tweaks to the homepage and a new homepage and a lot of support materials. So let's dive in. Improved reporting and the first two I want to talk about are improved reporting and exporting schedules to personal calendars. We will look at these as we go, but basically we know that these were sort of the big core things. Is one, I want to have more access to my connector data and be able to use it in more places. And two, I want to be able to have one place truly to manage my entire calendar, my life. So these are 2 features we've been working on. Again, we'll show them off. These were also 2 of the most requested features when we did a survey at the end of Open Enrollment 6. So we're really excited to have these, and we think that they're a really big boost for users, as well as for sort of the general experience. We've also added one-off appointments and more customization in scheduling. Thank you all so much who were on last year for dealing with a sort of bare bones connector. We really wanted to make sure we had a faster experience last year, a tool that we could better support in the future, and that required trading off with some flexibility and customization and modifications. However, we've brought back some of that this year, and we're going to show this off. You can now add individual appointment times. You can change schedules after they've had appointments booked. You can modify individual appointments. You can do all that good stuff. As we said, schedule improvements, the ability to edit schedules, one-off appointments, users overall having more control over their connector experience, less time creating new sessions. I want to talk next about some widget improvements, some things that we're really excited about here. In the past, there's only been one way to use the widget, or at least there was last year, which is that you search by zip code, you find a location, you book an appointment. We wanted to improve that. We wanted you to allow to direct consumers to specific locations where they can book appointments. You can use this for promotional materials. You can use this for, if you live in this area, go to this website. If you go to this area, go to this website or this link. Really specify based on geography, based on proximity, making sure people are going to your high traffic, high volume locations. You can use it for enrollment events. For people who still do larger beginning or end of open enrollment events, you can use it to direct and publicize people to specific locations. You could also use it for outreach, right? If you're doing outreach at a college campus or community college campus, and you're doing enrollment there later that week, you can tell people, here's a link. You can go book an appointment directly here so that they know exactly where they're going. We'll look at this format here in a second, but it's going to be pretty simple. At the end of your normal widget URL, you'll add the word location and then equals and then the number of the location ID. Again, this will all be sent out and shared. We're putting these materials on the homepage, and we'll get that in a second. But overall, it's a pretty simple process to generate these unique URLs on the widget side. Lastly, we've made some improvements to the homepage and some other minor tweaks. Specifically, we've improved county tracking in appointments to make sure that zip codes are always up to date and that the county field is kept up to date. We've done a new homepage that will include updated training and support materials, a new video series, a new FAQ. Should be coming up probably overnight today, I'd guess. And finally, we've also done some smaller stuff, some tweaks to formatting, some tweaks to how information's displayed, just cleaning up the layout and design of the connector. And we're always open to hearing more ideas. So if you have anything, please feel free to shoot us a note, and we'd be happy to talk with you in more detail about it. So with that, let's take a live look at the connector and look at some of this exciting stuff in action. I am going to just make sure. Cool. Screen sharing is working. Great. So this is our widget. This is the front-facing side, the consumer-facing side, the public-facing side, whatever you want to call it. All are valid terms for the widget. It's at widget.getcoveredinamerica.org. Your local organization or coalition may have embedded this on their own website, in which case you should obviously direct people there, but it works the same everywhere. We like to start here both because it's what consumers will see, and because this is a big part of the connector. We find that 1 out of every 3 appointments are booked through having this interface, right? Having an ability for people to book their own appointments on their own time without having to interact with anyone. It also helps our national partners. We send email updates. A lot of other organizations are directing people here. We do digital ads. It's really a great way to make sure that people are getting the help they need in the way they need it. So it works pretty simple. You enter a zip code. You select a search mile radius anywhere from 1 to 100. I like to use 10. And then you can pick any language or any specific language if you're looking for enrollment assistance in one particular language or another. So for instance, if I needed Spanish or phone translation or sign language interpretation or Arabic, I could narrow down those appointments if I knew they were available or direct people to do so as they search, but we're going to leave it at any. So I can click this search for help here button and I see a bunch of results. They are sorted by availability and then by distance, right? So these first locations here are available this week. This one looks like it's in our same zip code. As we get further down, we go from a health center to what looks like to be one of our organization sponsors, a community interest group, a hospital, health clinics, all the different types of places that you will do enrollment at on a regular basis. You can find whatever one looks best. Again, we can see here as we get further out, we have this location available this week, and this one's available next week, so that people have sort of a queue of how quickly they could get in to be seen there. Now, let's say I want to pick this location here. Keogh Health Connection at Alhambra Family Resource Center. At the very top, we can see a really useful map. It gives us a visual of where this location is. We can zoom in. So I can see it is at, looks like North 39th next to the Episcopal Church. I can zoom out and see it's off of Glendale between 43rd and 35th and even further out and see where some of the highways are, which is really nice and can help people navigate. We also have all the information about the location. What is it called? Where is it located? If I have a question or need to reschedule my appointment or something's confusing, who do I call? How do I get a hold of them? So we've got a phone number there as well. We can also choose a different date range if we're looking for appointments further out, this week, next week, 30, 90 days, or we can just schedule one. So it looks like the appointments they have are available on November 7th, so a week from today is their next availability. I'm not a super early morning person, so I like this 11:30 slot here. So I'm going to click schedule. It's got now that same location information, the same map, as well as now it has our information on this appointment slot, including, in this case, it looks like they just sort of pop in whatever assister is available, but if a certain assister is assigned to the schedule, their information will show up. So if I put this schedule up, it might say with Phelan O'Neill. But we've got here the start and end, the length of the appointment, the day of the appointment, the day of the week. Simply to book an appointment, all a consumer would need to do is fill in their information. Invincible.org. Oops, 6863. Cool. Right, my name, an email address, and a phone number. Basic information so that people know who's coming and how to get a hold of them. They can choose to opt out of receiving email updates from Young Invincibles. We send a lot of reminders around both enrollment, health insurance literacy, basic stuff like getting a flu shot, all that good stuff to make sure that people are staying on track and staying healthy. We're not going to schedule this. This is live, and I don't want our good friends at Keo to think that I'm coming in to see them for an appointment. But if I did, a couple things would happen. The first is that there would be a confirmation screen that would show the consumer the information that we see here, the name of the location, the date and time of the appointment, who the assister's with, as well as a link to a PDF of what resources to bring, things like identification, social security number of everyone being enrolled, things like income information, tax stubs, whatever, as well as any doctors or medications that members of the family being enrolled want to make sure that are covered or covered appropriately on the plan. So, right, we've got all of that. The second thing that would happen is that both the assister and the consumer would get an email message letting them know the appointment's been booked, and the consumer would get a text message as well confirming their appointment. We found that this type of initial confirmation, really great way to make sure people know that their appointment's gone through. The final thing that happens is that the day before the appointment, there's another round of notifications that goes out to both the assister and the consumer. So for assisters, it's saying, hey, here's your upcoming day. Here's what tomorrow looks like for you. For consumers, it reminds them of their appointment. We know that you all have your own confirmation procedures, but we found that an extra nudge, an extra reminder, even just putting the information of that location in their phone or in their inbox at the very top is a really valuable way to make sure that they show up on time for their appointment and have what they need. So the last thing, and we had talked about this a little bit, right, is we said you can do these custom RSVP links to a specific location. So let's take a look at one of them, and then we'll pause and ask questions. So we have here, right, Keo Health Connection, another one of their locations in Phoenix, and it looks the exact same. We can even schedule an appointment, and it looks the same, right? All the same stuff. It just saves us that search and already has that location. And we've got that format, right? Location equals, and then the number. Now, the question that you're probably asking is, where do I get this number? How do I know that if this is the location I want, that 11635 is its location ID? For that, we need to look at the backend side or admin side of the connector, right? So this is a page that I'm sure all of you have seen if you used the connector before. It's a standard location page, right? We see here in this URL, this number here, right, to the right of locations, but before the word update, 11635. That's its ID. That's how we know, if they change their name, they change their phone number, whatever. that this location will always be this location. And so that number, again, 11635, just gets popped in here. And you can do that with any different location you have. And it's a really nice way to direct people, again, if you're trying to get them to book appointments at a specific place, to promote that overall and to get people better connected to the help that they need. So I've been talking for a bit here. I want to pause and I want to see if anyone has any questions. Again, you can either unmute yourself or you can speak or you can type a question in the chat box. Great, so I'm not seeing any questions. Again, if you have any questions about anything as we go, if something pops up that you wish you had asked, please feel free to ask it at any time, especially if you want to type it in the chat box. Happy to stop, happy to review anything that you need. So we've covered the front end, we've covered or the public facing side or the widget of the connector. How do we put this stuff in, right? There's a lot of information here. If I'm scheduling an appointment here, we have this location's information, we have a specific appointment time, we have an assister. Where does that all come from? It comes from the backend or admin side. So again, we're going to be putting up here. Oh, it looks like we got a question. Someone asks, will you consider adding the possibility of specifying days of the week or times for those looking for a specific availability according to their schedule? That is an interesting question. So there is some flexibility here. If we go back a page here on the widget, you can select this week, next week, 30 days, 90 days, and I guess we'd have to go way, right, getting way out further to see some of those results. So there is some flexibility on that. In terms of filtering by time of day or something, like specifically only Tuesdays at 6. On the widget side, that's something we might look at. We will show in a minute when we get to booking appointments on the back end, how you as an assister can help do that for people, or at least get closer to that. I don't think we've done anything like specifically I'm available Tuesdays at 6. But again, we can look into adding more specific filters over the course of time. But thank you for that question. So the first thing we need to do here, right, is we need an assister, right? We picked this appointment here, and we need who's this going to be with, right? Assisters are sort of the core of the connector. They're who uses this. There's who people are coming to see. So to do that, we need to add a new user. And let's click this green add user button here. We are going to call this user, let's use another YI staffer, Payton at yi.org. You can put in an optional phone number if you want to keep that record. It's not strictly required and it doesn't connect to anything right now. But there's a potential for it to be used in the future. Then you need to assign them a primary organization. So in this case, we'll give them Young Invincibles Training Org. This is sort of who's responsible for them, who they primarily work for. In some cases, they may be split across different organizations, and we'll look at that in just a minute. But this is sort of primarily, where do they work on a day-to-day basis? Whose data should they have access to? All that good stuff is set by this primary organization. We want to leave this as active box checked. This says, hey, this assister is still in use. Please make sure that please keep their account active. If someone decides that they're no longer using the connector or if they leave your organization, you can always uncheck that box later and deactivate the user. Then we have this is assister. This designates that a user is an assister and can be assigned to a schedule, meaning they can book appointments, they can have appointments and schedules associated with them, do all the normal things. This will be 90 to 95% of assisters or of users of the connector. There may be some people who are, for bigger coalitions, things like grant reporters or a foundation staff member or just someone who does scheduling work, or is at a call center or something that may want access to the connector, but isn't doing enrollment work themselves. You'll see here that it also selects a number of permissions by default. We have things like users, appointments, assisters, sort of giving people all the different sets of permissions they can have. The basic permission set is this connector permissions here. This is what 90% of users may do, and covers all your basic things: appointments, locations, setting your schedules, etc. You can customize this however you want. So if you're a manager and you want to control how staff add their schedules, you could remove some of those permissions. If you wanted to make this person administrator, if they're helping you troubleshoot things with a connector, you can select the admin permissions or unselect them at any time. And it gives you sort of that flexibility to know what's going on. Lastly here, additional partners, organizations, or users this user may access, or locations this user may access. We know that a lot of you all collaborate across organization lines. You may have coalition partners. You may have staff that splits their time between two organizations. You may be doing an enrollment event, even on a smaller scale, at just one location, but split across a couple of different organizations. This is a great way to, if we do say, we can add one here. We added location, Waystar Royco. We could add another organization. Again, you don't have to do this. This is totally optional, but in cases where you're collaborating across different organizations, this is a really good way to make sure that people are not duplicating efforts, and that you can have one location where everyone's booking appointments, or that everyone can see sort of each other's schedules and book appointments collaboratively. So in that sense, it's really useful, and we're really excited about it. So then we simply create our user, and now we have Payden here as a user. One of the nice things about the connector is that all of these different search boxes here allow you to narrow down your results, right? So I could search at younginvincibles.org, right, and just find everyone with an email address at Young Invincibles. If I needed to find just a simple user's account, I could do Mina, and I can either hit enter or click update filters, right, and it will narrow these down. If I want to clear that, I can reset it and go back here. Every page has the ability to edit and delete everything, with one exception. The beauty of the connector is you can't really delete anything. Everything still stays in, it just becomes inactive. So I'm going to check this box off here. Right, so let's say Payden is leaving Young Invincibles, and so we want to delete his account so he's no longer on the connector. Click this delete button here, it makes him inactive. Right, and if I were to refresh this page, I gotta do it. Right, so it's not showing inactive records. Payden's hidden. This is sort of the default. If we want to update and show it, we see he's been crossed out. It shows that he's inactive. He can't be assigned to anything. He can't access the connector. Now, maybe it's been a year and Payden says, oh my God, I miss open enrollment. I miss doing enrollment work. We can bring him back here and we can make it active, right? And then we update it and voila, Payden is back in business. So yeah, these are features that work across the entirety of the connector, and we really recommend taking advantage of them. It's a great way to sort of control what's active, what's not. You can do it across locations. You can change these things as we go. So the next thing here, right, if we're going through our list here, is we have an assister. Now we have to put in our location information, right? So if I go back here and I go to locations, I need to add a new location. We're going to call this, what should we call this? We'll call this Y North. Young Invincibles. We'll give this an address of, that's a great question. Let's do 300 Hennepin South, Minneapolis, 210-6863. Right, so we've put in our basic information here. What is the address? Where is it located? If someone needs to get a hold of them, what is the phone number here? If you have a suite number or special instructions or something, you can put that in the second address line. But for this one, we won't. Right, and that matches up again, going back to the widget with this information. The name, the address, and the phone number. The next few options here are different permissions or settings that you can have for each location. The first one is if a location is private. We really don't recommend using this in most cases. Again, as we said at the beginning, 1 out of every 3 connector appointments comes through the front end or widget side of the connector. And so it's really something that's valuable to have. We can direct people to them, to you all, to get enrolled. You can have partners, community partners, book appointments with your assisters and make sure that they're knowing where to show up. But in some cases, like we're working with a group in Florida right now who wants to do some custom work with a healthcare provider system, right? Where they want to be able to go on site and help enroll their clients in health coverage. They want to track their stuff in the connector. They don't want anyone else to be able to come and book those appointments. So in that case, they could mark them as private. Agents and brokers should be marked as such with this broker location here. We have nothing against agents and brokers at YI. We know that in some cases they're very valuable partners of the enrollment community, but you know, they play by a different set of rules. They have different requirements, different legal status, etc. And so we just ask that their locations are marked as such, so that people get a disclaimer saying, hey, this may or may not be, they may or may not show you healthcare.gov. They may or may not be talking to you about tax credits or showing you all your options. Please just make sure to be careful and to ask questions if you're confused. Someone said consumers are not getting that second line of further info on the location. I would say if you can send me a support email with more information on that, I'm happy to look into it, but it's sort of hard to diagnose objectively. That's another great question. Next is this location has been trained for working with LGBT people. So if we go back here to our results, right, this first location here, Noah Midtown Health Center, has a little rainbow icon next to it. That is because they have been trained by our partner at Out to Enroll on some LGBT cultural competency and health specific questions that are important or may be important for LGBT persons. It also flags on Out to Enroll's website where they promote their resources and make sure that they show up higher there. It's a really great training. It's pretty short. It's self-guided. Happy to direct anyone over to them who's interested, but that's what this is for. Then the next thing we have in the final setting for locations, and then we'll stop for questions again, is languages supported at all times by this location. So what that means is that if all of your staff is English and Spanish bilingual, then you'd want to put that there. If only some of your staff was bilingual, or maybe some of your staff also had phone translation services, or also spoke Arabic, or also spoke Creole, You can set that up later for the individual schedules if they want to offer assistance in that. But this says, hey, regardless of what anyone else enters, all the appointments at this location should be showing up as Spanish and English availability. So then simply we can create our location here, and it saves our new location as YI North. I want to pause here before we go any further and see if anyone has any additional questions. Great. So going back here to our appointment or our widget, right? We now have this location. We've gotten our sister. How do we put in this time stuff? How do we know when people are available to book? For that, we go into the scheduling tab here, and we click on the schedules page. We'll go through what each of these different buttons means in a second, but first let's look at adding a schedule. So the first thing the schedule needs is a title, right? We'll call this Marketplace Enrollment. It will be at YI North. It will be with our new assister, Peyton. And then the next thing we have to determine here is time before an appointment, after which will no longer be publicly displayed for consumer booking. So what does that mean? Going back to our widget here, this looks like it's an appointment at 8:30 a.m. Mountain Time. We know you all are busy. We know it takes time to get set up for each individual consumer. It may take time to wrap up an appointment. You may need to rebook a consumer. You may need to travel to a location. Maybe this location is, 45 minutes away from your home. And so, you only want to go there if you know that someone's going to be there. Or you just don't want people to walk in and be surprised when you're not ready for them. This allows you to set sort of a buffer time of how long, how close to the appointment should we hide it. So again, 8:30 in the morning, we set this to 90 minutes by default. So at 7 a.m. Mountain Time on whatever day that was, November 2nd, so this Saturday, you wouldn't be able to see this appointment. The appointment that we saw on the widget, again, it would still show up on the back end. You could still book people for it. You could still enter after the fact. We just don't want people to be surprised. If you're tracking, if it's part of a bigger enrollment event, a bunch of assisters getting together, doing a big event, you can mark that as such. If just this schedule is private, maybe it's overflow hours, maybe it's backup assistance, someone who predominantly doesn't do assistance but is available sort of as needed, like a manager or a program director or someone who maybe isn't on the ground as much. You can mark that schedule as private, and then you can check any languages specific to this schedule that are being offered. So let's select Arabic here. You can also add any accommodations that you want. So I'm going to mark all three. Cool. So now we filled in the details, right? What is our schedule called? What languages are being offered? What accommodations do we have? Now we need to tell the connector, when are we available? So I'll call this Monday and Wednesday. You can add an optional description, and then you pick a start date and an end date. So I'm going to create Monday and Wednesday for open enrollment. So through the 15th, 9 o'clock a.m., 5 o'clock p.m., 60-minute appointments. I don't want a break between them. Create that, and now that's saved. You can stack these as much as you want. There's no limit and Thursday on how you do this. I could do Tuesday and Thursday. Again, 11/1, 12:15. Let's say I do 10 o'clock a.m. to 6 o'clock p.m., 60 minutes, no time in between, on Tuesdays and Thursdays. Now, Fridays, maybe I don't generally do enrollment, but during December, I want to be available right from December 1 through the end of open enrollment. And we'll call this Fridays and make sure that we're available on Fridays. And we'll do 12 p.m. to 7 o'clock p.m. Again, 60-minute appointment length, no time between appointments. Right, so we can stack these. We could have as many. We could do another one for Monday, Wednesday. You can have as many of these as you want, as many rules as you want, whatever makes sense for you. To view that, right, and to actually see what this looks like, we click this calendar button here. And we see, if we go, I'm going to go forward a month, and it'll take a second to load all of these occurrences that we just generated. Right, we see our availability. We see, right, 9 to 5 on Monday. We see 10 to 6 on Tuesday. We don't see anything on Friday until we get to December. Right, we could go back and manage the sessions, and we could change any of these. So I could change this to, I want to stay an extra hour in December, actually. So I want this to go to 8 p.m. So you can add it that way. And then again, if we went forward a month into November, right, we can now see here that there's a 7 o'clock to 8 o'clock appointment. From this calendar page, you can do a lot of things. You can see the assister, you can see the location, the languages and accommodations being offered. You can also see these individual slots, right, and book appointments in them. You can also update these individual times. I'm actually going to change the schedule I'm looking at here to, let's do this one here so that we can show one with booked appointments in it. Great, yeah, so like this one has a couple of booked appointments in it. We have, right, if we click on a booked appointment, you can see that it's highlighted in red. It now shows the assister and the consumer's information, as well as the location, the appointment time, and a link to schedule to edit the appointment. You can also change these, right? You can change any appointment that's not been booked. You can change its availability, right? So this says it starts at 10:09. Let's say we want to change this to 10:11. We can update that, and now that's saved. Right, so now we can change each individual one. We can also, if we wanted to, say, delete one of them, right, we can either deactivate it and just make it unavailable for booking, or we can just actually delete and get rid of it entirely. Now, I saw there's a question here. If you edit a schedule, it will not duplicate or delete existing slots or appointments. That is a great question. So if you edit an existing schedule, for instance, let me find one that has upcoming appointments. So, I'm guessing this one. We can show you exactly what happens there. Or here, does this have any appointments booked? I'm trying to find one where I can show you off exactly what you're thinking of. Okay, let's quickly book an appointment. So we'll come back to that. That's a great question. We're going to hold on that for a second. But we will come back and show what happens for that. One of the nice things that we've added here, and I'm actually going to go, right, you can view calendars by location or by assister as well. So I'm going to go here to this Assister calendar. I'm going to view one for connector support. Right, and this is really nice, right? If you're an Assister, you can have your whole calendar that you can see by location. If you're like a site manager, you can do the same thing by location. You can also now sync these calendars with your own personal calendar, and that's one of the new features that we wanted to talk about. So to do that, you click this iCal feed link button here. You can copy this link here, and this is just what's called the iCalendar file format, but it's really just a feed, right? You don't need to worry about the details of it, but essentially for most popular calendar apps, things like Google Calendar, Microsoft Outlook, Apple Calendar, it allows you to subscribe or add these calendars right from this source to your personal calendar. So on Google Calendar, under other calendars, you'd click this button here. You click from URL. You can paste in the URL, and look, it's got the URL, the connector dev. We add our calendar here, and now it's been added. And if we go back, right, we can now see that it's populated with my appointments for the week, right? And it will update periodically throughout the day to make sure that it continues to be up to date. So that is how calendars and schedules work in the connector. I do want to come back and show that someone had a really good question about duplicates if you add sessions like this. But before we look at appointments and some of that stuff, I want to pause and see if anyone has questions. Other questions, I should say. So someone asked, so this updates automatically, you'll not need to keep on doing that process. Yes, it may take a couple of hours to fully sync. It's not instant. It's up to your calendar provider, but it should happen within a couple of hours so that, you know, it will sync up. But yeah, you don't need to do that like daily or every time you book an appointment or anything. Just the one feed. It can be any schedule. It can be by Assister. It can be by location. I would guess it's probably best to do it by Assister if you're, an enrollment Assister, so that you have your whole schedule. But that's technically up to you. Now, if I wanted to, I'm actually going to show this here, right? So the question was, and I found an example of this, right? We have appointments here, I think on, what day of the week was that? I think it was a Friday. Yeah, so we've got an appointment tomorrow at 2 o'clock. So we want to edit, if we go in here, manage our sessions for Fridays, which looks like it's this one, right? If I wanted to add another hour here, right, and extend it longer, it'll tell you these are some slots that might become duplicated if we update it, right? So in the same way, if you're familiar with how the connector worked before, that, if you change things or update your schedule, it might create duplicates when you've already got an appointment booked. That is still true, but it shouldn't create duplicates generally, for your open slots. It should delete all the open ones and rerun it. But again, if you have any issues with that, if you catch anything weird, feel free to contact support and we would be happy to help. So, booking appointments. Oh, the last thing we forgot to show, you can add one-off appointments here to individual time. So you can just need to give it a session name, 4:30 p.m., 5:30 p.m., right? And you do that as many times as you want. but you can see it's updated on our calendar here. And all you have to do it is to click on the blue button, right? The blue number of that day of the week or that day on the calendar. Yeah, so to do this, right, to use this feature, to add one-off, you click this blue number, in this case, the 16th, or we could do it for today, right? You have to give it a session title so it knows what to show in the widget. We'll call this 5:30 to 6:30. And now we have a 5:30 p.m. slot here. And you can do that as many times as you want, and it just creates these one-off occurrences. Right, so again, all you have to do is just click that blue number for whatever day you want. Cool, appointments. Obviously a key part of the connector, and right, it looks pretty simple. You fill out, and it looks like we have another question here, so I just want to make sure. Yeah, I'm glad you like it. I'm really happy that people are going to enjoy this. I think it's a really nice feature. To add an appointment, you put in the consumer's basic information, right? Their contact information, phone number, zip code, and it will automatically populate the county. We'll talk about these statuses because we booked it from a calendar. You already have this appointment slot filled in, but you can also do this, right? If we went here from the scheduling tab to appointments, you can add a blank one, and you can use this find an appointment as a way to narrow it down, right? So if you were looking for a specific day, right? We'll say 11/3. Right, so the 3rd of November we're looking for, and we want it at Waystar Royco, right? We can search as specific as we want here, and we can see, oh, you got to put in a zip code. I forgot, 20036. Right, so now we have just these results starting on that specific day, and you can narrow it down as much as you want. You can do it by location. You could do it by a sister. Right, and the results now change to just show ones with that. So you can create an appointment and it will take you back to the previous screen, or you can click save and continue editing, which we're going to do here. Oh, I've got to put in the consumer's info. Alan O'Neill. And apparently we didn't select a slot. 20036. Now we picked an appointment. We can create it, and it will take us back to this page with the calendar. And we can see that it's been, appointments that have been booked. We can also edit in what we call closeout or update appointments, right? So if we got their zip code, for instance, at the appointment, right, 55404, it populates the county. These are the things that Y wants and sort of expects for our data purposes is phone and email where possible, as well as zip code, appointment status, which sort of says generically what is the outcome of this appointment or status of it, scheduled, was it confirmed, was it completed, did they cancel, enrollment status, enrolled or renewed, Marketplace or Medicaid, did they not enroll, was it health insurance literacy or some other post-enrollment assistance. You can also track things like referral sources, right? TV, radio, print, email, mail. You can track the consumer languages. You can have, if they don't want to be notified, right? If you're entering an appointment after the fact, you can suppress notifications. If they don't want to be called or share their data, you can collect story information here. You can collect follow-up information. And then we have, for navigators, the CMS reporting requirements. So I'm going to quickly fill this in here with just the basics. Most navigators are expected to fill out this section. Again, what you need to fill out specifically is between you and your employer and your coalition and whoever provides your access to the connector. So I would check with them to find out more information. But again, YI appreciates and sort of needs phone and email, as well as zip code, and then keeping the appointment and enrollment statuses updated. So we'll update this appointment. It'll bring us back there. We're running out of time, so I want to quickly run through reports. We have 3 reports. We have our standard appointment detail report. You can change this in any of these however you want and update them and download it into a spreadsheet, right, that has the same information here as we saw on our screen here before, right, and you can narrow it however you want. This is sort of the standard appointment outcomes report. This is what you'll use primarily for reporting, for data analysis. We also have 2 new reports here. We have an upcoming 48 hours appointment so that you can see what appointments are coming up in the next 2 days. We also have an unclosed appointment report. So appointments that have a status, appointments are closed if they have a status of canceled, completed, or no-show, and have an enrollment and if they are marked as completed, have an enrollment status. But you can see the appointments you haven't closed out. You could download a report on this and get this information. Again, these reports may not be a part of your day-to-day work, but we wanted to give you all more access and more control over your data. So I know I just blew through a lot here, but I want to keep us finished before 3 o'clock Eastern so that you all can get back to your days. Are there any questions on appointments or reports, or I guess the tail end of the calendar/schedule? One question. Can we get only the info we want on the reports? Yeah, I mean, you can narrow this down. If there's specific things that you feel are missing or need to be changed about any of these reports, feel free to send us an email and we can take a look at it. But generally we have, you have that same flexibility as you've always had. Can we get just names, contact info, location, status? I would say send us an email. We're happy to take a look and try and change these things. But feature design requests like that should be sent via email. Very quickly here, last thing, and then I will let you guys go unless there are further questions. Contacting connector support. We know that this is a big tool that does a lot of things, and some of it's really exciting, and some of it's confusing, and some of it doesn't always work the way you thought it did. Best thing you can do to start is ask your manager, ask your local admin, ask your neighbor, ask someone else to just talk through the problem with. Oftentimes they're quicker than we can be at Young Invincibles. Oftentimes they may have more contextual answers than we do. And sometimes it's just useful to talk these problems out loud with someone. I find it really helpful in my day-to-day work providing technical support. So I really recommend that. If all of that fails, if something seems catastrophically broken, connector support at younginvincibles.org. Please send all of your support issues there. Please do not send them to me. We now have, as we expand our ACA team, some other people that are going to be pitching in. And so it's really important that everything goes that is a support question to connector support. Some best practices for emailing connector support, and probably for emailing your managers as well. First is be specific. The more detail you can provide in both the subject line and in the body of your email, the better. Emails that I get that are like, I'm having a problem with my location at Annalise's Health Center in Chicago, Illinois, to just make up a location. It's not showing up in the widget. Is a whole lot more easily diagnosable, and I can spend less time trying to figure out what the problem is and quicker answer it than the connector is broken or my locations aren't working. Include URLs and screenshots. We went over this a little bit. but everything from, we'll just pick a schedule here, schedules to appointments to locations to users all have a unique URL address here that includes this ID number. Sending us a link is great. Absent sending a link, sending screenshots are useful as well. More detail is better. More information is better. Lastly, just be patient. We have a 24-hour turnaround policy for connector support. Please know that we are trying to go through these as quick as humanly possible. Sometimes we don't have an answer right away. Sometimes we're backed up. If it's been a day, please nudge us again and be like, hey, what's going on? But otherwise, just try and be patient. We're all working for the same goal, and sometimes it takes time to figure out what's going on. So it's now 3 o'clock. I want to see if there are any questions here before we wrap up. It looks like we've got one more in the chat. For appointment session, how can we narrow the client's appointment since it's a long list? Every time when I schedule, I need to go down the list. It takes time. That is a great question. So there are a couple ways, right? If you're trying to find like an individual appointment time, there are a couple ways to do it, right? You could, from a schedule, right? If you knew I'm looking for my Thursday at 5 o'clock, right? You could go to our Thursday at 3 o'clock. You could look down there, right, from a calendar page. If you're looking for specific consumers information, right, as opposed to scrolling through this whole list, this isn't, I'll have to use, let's use the last name test, right? You can search by just a last name or a phone number. You can do that as well. Right, and you can find people that way. You can also, right, for add an appointment, if you're looking to book an appointment, you can use all these different things here, right? We can put in a zip code. We can put in location. We can put in an assister. I think, oh, maybe not that much specific. But right, we can narrow it down here and find results that way, right? So that we have just the ones that are as close as what we're looking for, or we could change a date. So there's a lot of ways to do it depending on exactly how you're trying to customize it. Play around with the different filters, play around with this appointment search. That's my best recommendation, right, is you can search through right here, right, and find an appointment. There was another question here. There is an overlapping series of webinars Tuesdays and Thursdays with Beyond the Basics. I can look into that if someone can send me that information. I was not aware of that. But yeah, we are happy to change the time of this webinar if that is accommodating to more people. So if you could just shoot me an email, I think it's Gail who said that, with information about that other webinar, I would be happy to check with our team and make sure we reschedule. Cool. I know there's a ton that we've covered here today. Again, connector support at younginvincibles.org for support questions. If you have general connector feedback, if you have ideas of how to expand the connector, if there are features or upgrades you'd like to see, or if you'd like to discuss working with Young Invincibles on one of your next technology products, if you're doing other work outside of open enrollment, where you could rely on, you know, a new website, an app, or whatever, feel free to email me directly, phalononeal@younginvincibles.org. Otherwise, thank you all so much. I know we went a little over today, and I'm happy to, you know, I'm happy to help. Someone asked if we have access to these slides. Sure, I'm happy to share the slide deck with you. I generally think that the full recording might be more useful than these slides, considering there's not a lot of content on the actual core features. But if you want to shoot me an email, I am happy to send out the slide deck we use for the presentation to you. Otherwise, it's now well after 3 o'clock. I want to let you guys get back to your day. Thank you all so much for hopping on. Yep, if you missed the training webinars, if you've missed some of this, they will be going up onto the homepage of the connector very soon. We're going to link to our video series. If you're also on our general admin, connector updates list, I'll probably send out this version of the training for you all as well to watch that way. But yeah, so either through the front page of the connector or via email. I'm also happy to answer any questions or schedule a time one-on-one to talk through specific questions you have if you want to reach out to me. Otherwise, again, thank you all so much. I know this went a little long. I hope you have a great rest of your day. And thanks for doing what you do.